All right. Hello, everyone. Thank you all for coming. My name is Nisa Quintanilla Arteaga, and I am the president of Path SIG. We're very excited to continue with our annual Spring Symposium with our Transitions to Residency panel discussion today. And just as a reminder, we'll also have the first series of our Step 1 study sessions with Dr. Cameron Mirza right after this. We want to thank you all for your attendance and hope that this event is informative for those who are about to start residency soon. And just as an FYI, we will be recording this session and we'll upload it online in the next few days. And at this time, I'd like to have the other members of the virtual PathSig who are present to introduce themselves.
Hi, everyone. My name is Tristan Jordan, and I'm one of the event co-chairs, and I will be helping moderate the Q&A session today.
Hi, everyone. My name is Jerome Gibby. I'm also an event co-chair. I am a fourth-year med student at WVU, matched into pathology residency at UPMC for next year. Thank you all for joining us.
And now we'll introduce each of our panelists. If each of you can go ahead and introduce yourself and let us know what institution you're training at and what year you are, that would be wonderful.
I could go ahead and start. My name's Ade. I go to Stanford. I'm a second-year resident.
I'm happy to follow behind her. I'm Kyle. I'm a first-year resident. I'm AP only, and I'm at the University of Virginia.
I'm Ade Yinka. Yinka is perfect. I'm a PGY4 pathology resident at Indiana University and also future cytology and GI fellow also at Indiana University. So yeah, I'm locking down for 6 years.
All right, thank you everyone for introducing yourselves. So we're very happy that you're able to join us to share your insights about pathology residency. Just to give everybody a layout of how the events will run today. So we will ask directly a question to each one of the panelists, and then ask if anybody else in the panel wants to add anything. And during this event, we will also take other questions via chat. And then if there's more time near the end of this event, we will also verbally ask the questions that have not been answered on the chat. So to kick things off, the first question is for Dr. Carlson. So first question is, could you please state the fellowship you plan to pursue and how you came to that decision? And as a part of that, as a part of this big question, how should one go about discovering which fellowship they're interested in during residency?
You saying Dr. Carlson just like really throws me off. Yeah, I can talk to that a bit. And Tristan, you didn't tell us earlier where you were going. That's the other thing, where you matched to. But anyway, yes, I can answer that question. So I think I was very passionate about women's health when I came into medicine. So for me, I was somewhere between, or in my med school days, I was between OBGYN and then pathology. I was kind of torn between those two fields. So I think pathology was a nice way for me to be able to bridge both interests. So ultimately, since I'm very passionate about women's health, it was kind of natural for me to pursue women's health pathology. So I will be doing GYN and breast fellowship at UVA. I plan to stay on board with them, and then probably cytology as well. So I think for some folks who come in who already know an area of interest, I think it's nice to just kind of explore it early on. If you have that availability within your schedule, I know a lot of PGY1 schedules are pretty, I don't know if they, like at other institutions, I don't know if they permit elective time or not. But I would say pursue it early because a lot of people will kind of think they're interested in something and then they start doing it and then they realize, oh, that's not great, or it's not a good fit for me. It's not what I thought it was. Because you have to think about it in the sense of too, when you do a fellowship, we often in pathology, we think about like neoplasia, right? Like that's kind of what gets us excited. But there's a lot of other benign and there's a lot of medical entities. So if those things also don't interest you, maybe just think hard about it. because there's a lot of those areas that you will have to be, you'll have to be responsible for as an attendee. So I would just say if you have an interest, I would say approach a faculty member and see if there's a way that you can kind of get some exposure early on. We do general sign out. So I think one of the perks of general sign out is that you have the ability to kind of sample a lot of things early on. But within your first year, even in a non-general sign out kind of approach, you'll still do, even in subspecialty, you'll still rotate within those fields. So see if you can see yourself in the shoes of those attendings, right? And then try to see if I think you have to have a good intellectual interest in the working group. I think that's really what it comes down to. So yeah. That answer all parts, Tristan?
Thank you so much, Dr. Carlson or Kyle.
Kyle, please stop it.
Okay. I worked with Kyle for a couple of years now, but so we know each other. So in terms of so thanks for answering that question. It's very informative. And just to sort of answer, just to tell everybody where I matched. I actually matched in Yale, New Haven. So I'm really excited to start. And but yeah, I think this is something that I'm interested in knowing about because you know, as somebody who wants to start residency, I kind of want to make sure that um I'm always kind of thinking about the future, and like whatever I do is like going to eventually allow me to land the fellowship that I really want to go to. So does anybody else want to add anything else to the following question?
As someone who went through this process fairly recently, I think as much as people that come in having something they want to do, they're extremely lucky because it makes life really easy for you. You just hit the ground running and then you go. Sometimes you don't know what you want to do. And you do a blood bank quotation, you're like, wow, this is the best thing in the world. And then you go to search partners and like, oh, this is the best thing in the world. And then you go to micro next and you're like, oh, maybe I like micro most. And so um keep an open mind and kind of, give your best in every rotation, even when you know you might not go into that because you just want to have a good reputation sort of everywhere. That being said, take it easy. People change their minds a lot. I've had people that, and it's not a minor mind change. Maybe GI to GU was like maybe derm part and the person changes their mind to blood bank. And so I've seen people make serious jumps throughout the course of residency. So give yourself some grace in the first year. Just try and go through your rotations as usual. If you have an interest, fine. If something speaks to you, do more work into that. And if you change your mind later on, that's okay. So when people look at fellowship applications, they understand that residents change their mind. So it would be nice for you to want to do GU and have GU like research and stuff. But if they see you are active in something else, they're like, oh, this is still a great resident because they like something else before, they did a lot of that, and then they changed their mind and they're still a great resident. So yeah, I understand it's kind of, a lot of tension wanting to decide really quickly, but at the same time, people change their minds a lot. People change their minds at the end of their third year, fourth year, in fact. And so yeah, I think it works out eventually. But by all means, if you have something you like initially, just go for it as much as possible, as early as possible. So
I was also gonna just add to that, like it's common for people to do two, but lately, like you don't have to do two because the job market's so great right now. But if you do want to do two, and you don't have to necessarily apply for both at the same time. For me, I originally came in with a plan of doing Cyto and SurgePath. Cyto for sure, regardless. But I'm still want this if I should do something else. And then I was talking to people about it, and I could apply. And the plan is like right now I'm applying for Cyto, and then I'll have another year to think about it. So it kind of does buy you some time as opposed to just like, okay, I've had 2 years, and then now I'm going to decide. It's especially hard at my program because we do AP the first 2 years and then CP the last 2 years. So it's like it's kind of a big step to take, not having seen most of CP. So that's just something to keep in mind. You
All right, thank you for that information. So moving on to the next question. As current pathology residents, what were some of the important steps you took between matching and starting residency to prepare for this transition? And this is a question directed first to Dr. Akinsanya.
I matched in 2020, so that was the best year in recent history. And so after I matched, I spent the next couple of months reading novels and watching TV because I couldn't go out. So I think number one thing you should do is rest. You hear this online all the time. You hear people say it, and it sounds cliche. And I don't like cliches, but unfortunately, most of them are true. So please get as much rest as possible. Residency is going to be residency. Whether you study every day to July 1st or you sleep every day to July 1st, it's still going to be residency. So get some rest. Um, I know a lot of people focus on the academic part, and it's nice to get some background if you can. But I think in between, like besides getting your rest, if you're able to take step three, by all means, or as early as possible when you start, so that's a big deal. Then figure out the non-academic part, so where you're going to live, or the onboarding procedure, which is like 3 million documents that you have to sign continuously back to back to back, and getting your license in this new place, and what are the things that they do for fun and hanging out. Figure out most of that because most of the pains you're going to have in the first couple of months are going to come from just onboarding and hitting the ground running and all of that. So between matching and actually starting residency, I think those are the most important things. Reach out to residents in the program. Where are the best places to live? And I think there are questions that come around to this later on, but try and sort those things out first, and then get as much rest and relaxation as possible if you have the rotations that allow you to do so. When people say it, it's true. Trust me, it's very true.
Great. That's very helpful to know and very informative. Does anybody else in the panel want to add to that?
I laughed a little bit when you said that question because I just thought to myself, I'm like, well, I didn't do anything that was actually contributing towards residency. Yeah, so exactly right. I would say definitely relax and chill. Something that's kind of overlooked that I do think is important is just a overall kind of wellness thing. I would say if you have any kind of like medical appointments and stuff like that, definitely try to do that before you start residency. Like if you've been putting off maybe getting your wisdom teeth removed, or if you have really bad tonsils, really bad tonsillitis, I don't know. Like if you've been putting off a few of those things, that might be, it's not the best thing to spend your free time before residency doing, but I would say if you can remove some of those other life items that will add stressors to a new kind of experience already in your life, I would say go ahead and take care of those. Um, but I think a lot of programs now understand that most people come in with, I would say, a limited view of pathology, or if you even have like a good view of pathology, they're not going to expect you to come in as a diagnostician. So I would say just use that time for overall wellness, whatever that looks like for you. Yes, it is a cliche, but no one's going to expect you to come in being able to sign out reports. Like that's unrealistic. That's why you're a trainee. That's why you're there. So take that pressure off yourself.
Yeah, I just wanted to also echo the health thing because it's so interesting because I mean, I think a lot of people, like, not that we choose it because of the lifestyle, but I think it is one of a perk that people like think about with path, like compared to something like surgery or something like that, like, or we have more autonomy in our schedule in a sense that maybe you wouldn't have to if you had to be rounding at the certain day. But I think people tend to at least I did, like underestimate still how much work you would have to put into how much work you have to put into it emotionally and physically. Like, yes, like I guess compared to other things, we have more autonomy, but like there's still a lot of times I'm at the hospital late at night and or you have just like crazy things to gross and just a lot of things. There's just a lot of stress and stuff. So if you don't have like your wellness and all those health things in check, it just becomes harder to try to do that later. Especially like at least at our program, we're like all AP heavy in the first 2 years, and AP at a lot of places tends to be the most like time consuming in terms of your hours as a path resident. So it's like it's been hard for me to even like get my glasses because I've been just stuck. And when I do have time off, like I have a golden weekend, and I still haven't really found the time to like figure out like get my appointment from like an eye doctor and do all these things. It's just like it's just easier to do in your fourth year to just get all that lined up. And then also building a routine for like working out and like meals and everything. I think that's so important. I know a lot of people before med school started that and just like refresh that your fourth year because you know it kind of falls off like during med school, but just like refresh that and just like have a list of like easy things to do. Like I'm lucky in that I have a Trader Joe's like 5 minutes away from me. So I have like set salads and like little meals that I know I can just get really quick or like meals that I can like make in 10 minutes and stuff like that. Just like have a list of like you want to make it so that way you're using as tiny amount of energy as possible to like take care of yourself. So you can just focus on residency because it is still hard and just like don't underestimate how hard it is. I'm not saying that, and I don't, and I agree, like there's nothing you can really do to prepare yourself for path residency just because the way med school is set up, it's like not really set up to teach you to be a diagnostician. It's set up for you to be a clinician, right? You like rotate through everything as a core, and path really isn't a core rotation in med school. So there really isn't much you could do. Like, yeah, you could try to read and do this and that, but like reading a textbook is so different than the actual practice of pathology. So just like, I think the best thing you could do is just get your mind right, get your soul right, like your spirit, and just like accept the process and everything. I mean, if you do have anxiety like me and you are like really like and I'll just preface by saying the studying I did before did not help me at all. But like if you do have anxiety and you want to do something for like maybe like 20 or 30 minutes, my program did have like pre-recorded lectures that were specific for the program that helped out. And like so you could like watch those like intro to grossing lectures or something and then be like, well, I don't understand what's going on, and then accept that that's completely normal, but like at least ease your anxiety, but just know that it's not going to help. It's just going to be rough. The best thing you can do is just get everything else in check, things that you do have control over, and relax and just be ready for the process.
Yeah, wow. Thanks so much for the great advice. Something that um, I will find very helpful during residency for sure. And just to kind of follow up on that question, so if programs are now asking us to kind of schedule our days off for this upcoming residency year, do you guys have any advice on or on a strategy how to sort of like divide or distribute our weeks off? Anybody can answer.
For me, like weeks off are so important. I like my program, before our union, we only had 3 real days off and then like a week off of ed for education, but now we have 4 weeks off. And because of the way scheduling works, you can only take off a week at a time. You can't just do like here and there, take days off. So a week at a time. And for me, like, I think what's important was just knowing like for me like having a set week for like to see family. So for me that was good. So I'd usually like at least request like one major holiday, at least like Thanksgiving week or Christmas week. And then another one is like if you could just plan a week that will be like a vacation thing, that'll be like so great for you to look forward to. For me, last year it was Coachella, and I feel like that like gave me like motivation to keep pushing through. So I like line it up because Coachella is usually the same two weekends every year. So I just line it up. So I'd go the second week where there'd be like less people and just like do that. And then just have like a week, make sure that third week or whichever, how many weeks like is like spaced out from those 2 weeks, because it's really rough to chunk all of your weeks together at one time and then just push through. If you can just spread them out, that'd be really great. So like for me, the magic trio was like one for family, one for a cool vacation to look forward to, and then one for just like spaced out just to get a break, but try not to clump them together because I think that would be like pretty rough to push through.
I think that's great advice. I was going to say just try to do them quarterly. So if you have 4 weeks, try to space them out by the season so that you have something to look forward to. The one thing I will say is if you're given the opportunity between scheduling them versus leaving them kind of like flex, I would say just schedule them, because once you're in the grind, it is so much harder to try to fit them into your schedule later on. So my recommendation would be just schedule them and just exactly. So you have something to look forward to. Yeah.
One just final point, if you want like holidays, I made a schedule last year, which was fun. If you want holidays, like holiday time off, ask now or as early as possible. The closer you get to those days, the less likely it's gonna get approved because it's someone has to be around. And so yeah, if you have specific holidays, have a family trip or something you want to do, then you just book those down earlier on. And I completely agree with everything else. Space them out. Give yourself some light at the end of the tunnel. I'm gonna just get through this 2 3 weeks or this 2 3 months, and then wow, holidays waiting for me. So yeah.
Awesome. Thanks so much for the great advice. So just moving on to the next question, and this is a question directed to Dr. Adeniyi. So I know you mentioned that we should take a lot of quality time for ourselves before starting residency, but for those who actually want to do some preparation, what are the key resources that you used to familiarize yourselves with content before starting residency or early on during residency? I know you mentioned there's some lectures that were provided by your program, but are there any other outside resources that you utilized, like maybe textbooks or websites that might be helpful for incoming residents?
Yeah, I mean, again, don't do this, but if you really have anxiety and you want to, that's I totally get it, totally valid. Like, yes, I was looking that we had like intro to grossing things, but I think I'll at least tell you this, how I'll tell you resources that as a first year were really clutch, that if you wanted to peek and get familiar with, that'd be okay. Like I think that's totally valid, like just checking out the resources and seeing like how to read them and like creating a plan for yourself later. A big popular resource a lot of first year residents will use is Malavi's textbook. It's very basic, rudimentary. Like you could even read it from a medical school student level and like understand what he's saying. I think that's great. Another great one is called Kurt's Notes. A lot of people use that as kind of like a quick study sheet while they're going through cases. I know, like for me, like I still use Kurt's Notes, like, and I feel like every time I read through it, it's like I'm discovering a new thing somehow. Fun fact that he actually went to my residency program. So like a lot of the things he's saying specifically apply to my program. Like the cases that he's talking about are like very like heavy in my program. So it's like it's even more of a cheat sheet to me. But I still think it's very great for like just like on a basic level, explaining all like a lot of key topics really quickly, and it's separated by like organ system, which is really great and stuff. And yeah, I think those just having those two to start out with, I think are fair. But again, I wouldn't like get lost in the sauce because I feel like there's just something that happens in residency. It's really magical. Like you just all of a sudden like it just feels like you're grinding and nothing's making sense, and then all of a sudden it clicks. And it's just something that doesn't really happen until you're like working in the process. If you try to force it to happen earlier than it will, you'll just get frustrated for no reason. So um that's all I'll say about that, I guess.
It's great that you mentioned Kurt's Notes because I think there's also like an Anki version of like Kurt's Notes. So if anybody wants to also keep utilizing Anki, there's like an Anki version in online that you can use for Kurt's Notes. Um, kind of on that note on being kind of on that note on trying to be productive before residency, I was wondering what you guys' advice on studying for step 3, like how early should we start taking it, and what are the advantages of doing so? Anybody can answer this.
Take it yesterday. Like, as early as possible. And you've probably heard tons of people say this, and again, it's true. It's very difficult to think one way during your work day and then get home and study something else at night. It's brutal, honestly. And so having to think pathology during the day and you're looking at purple and pink and you're doing all of that stuff, and then you get home later on and you're looking at internal medicine and up, ups and guy surgery, all of that. It's a big difference. Anyone that has done, most people that have matched there did part rotations, and just try to remember how it feels to leave that part rotation and then go back to clinical service. It was like a shock to the body. And so yeah, the earlier you can take it, the better. Just schedule it as quickly as possible. Try to get it done, especially closer to when you just finish med school, because those skills are going to drop off as you go along with residency, I promise, unfortunately. And so just do it quickly, please.
You said unfortunately. I say fortunately. I was happy to offload a lot of that content. Yeah, I would say definitely do it as early as possible. If you're not able to do it, the other approach to it is try to schedule it at a time that is going to be lighter in your schedule. So once you get that, talk to your chiefs, talk to some of your seniors, be like, hey, when did you do it? When did it work best for you? Because not to say that our patient facing colleagues don't use their brain. I'm not trying to go there, but we use our brain a lot in pathology. It is mentally exhausting, especially as a first year. You are like a sponge. Everything is new. Everything is new constantly. And so having to revisit, like fetal heart rate race, no, it was just awful. It's just so the sooner you can do it and be able to offload those things that you won't be using in your day-to-day practice, the better. So if you don't have a plan for it now, talk to some of your seniors, talk to your chief, be like, hey, when is the right time to do this? How do I make this work? So help me do this right.
And for people that don't believe us, like in my cohort, we had people like me that took it like as soon as possible. And then we had people that waited till like towards the end because they're like, no, like I don't feel confident. Like it's like so hard and I just want to like be prepared and whatever. And like your step 3 score, I don't know about Durham residence fellowship because that one is like kind of weird, but all the other fellowships, no one cares about how you do on step 3. Like there's EKGs on it. Like they're asking me about like diabetes management. Like that's not path residency at all. And so it doesn't matter. Like you literally just have to pass it. And the more you wait, the more your knowledge from medicine just starts to drop off. Like it's crazy because like there's so many crazy things about EKGs that I had to know that I learned know so well that I like know nothing about now. Like I don't know, funny squiggle lines. But like there's just like so much that you're going to just drop off as you get more and more immersed in pathology, which I think is great. But it's also just makes it harder to take step 3. And there's just going to be a point where you peak in your studying because of all that you have to do during work and then coming home at like 5, 6, 8 p.m. and then having to study something completely different and then trying to take it. Like it's just not productive after a while. And I will say like the people that waited till the end to take it, like didn't say it was beneficial to them. They regretted not taking it as soon as possible, like everyone else did. Like I think I took it like in the first couple of months because I literally was like, I feel like if I just was able to take it the first day of residency, my score probably would have been even better. But again, it doesn't matter. It's just about passing. And what's more important is your boards for path, not your step 3 score.
Great advice by everyone. Just to kind of follow up that question, like approximately how much time did you spend like sort of studying in terms of like weeks or months?
4 weeks.
Yeah, about the same, like 4 or 5 weeks. And like I didn't even finish all of UWorld. I think I got like halfway through or something. I tried my best. It was just so hard. But again, like, and I think the thing that's difficult too is because now you can't take step 3. I think people used to be able to take step 3 before starting residency, but the way the new license works or something, like you have to be a resident, like you have to have started the program. So that's what makes it tricky. So now it's like harder to just take it right away. But like yeah, like you don't really need that long. I think that it's just about using all the stuff you learned to take step 1 and step 2.
And focus on the CCS part. The theory, like the multiple choice question part. I don't think you can actually adequately prepare for it because I don't know where they get those questions from, to be honest. They bring in step 1 stuff, steps 2 stuff, they don't jumble everything together and throw it at you. So CCS is, if you're going to prioritize something, make sure you try and finish the CCS portion. And then the more rudimentary, stuff is, some people do finish UWorld, but there are very few of them. I probably did maybe 60% and that was it. So
Great. Thanks for the awesome advice on step 3 studying. And for moving on to the next topic, and this is a question that I will direct to Dr. Carlson. Sorry, Kyle. I got to get used to that. What are some personal or professional goals that incoming pathology residents should set for themselves before starting residency?
I think professional goals is a challenging question to answer because I think that's going to change a lot as you kind of start and as you grow and develop as a pathologist. But I think in terms of personal goal, I received the advice early on, and I thought it was good advice, and it was that you should have a few things that you really value that's super important to you and hold on to those things once you get started. So if part of your like self-care is going to the gym, make sure that is incorporated into your schedule, in your wellness as a resident. Hold on to that and keep doing that. Like if that's something that's good for your mental health, that's good for that works for you. Everyone's going to be different, but I would say personally, that has been something that I have held on to. Like I have done a few things, or I've held on to a few things that are very important to me because right now in your fourth year, you have a lot of time to do a lot of different things that you want, but your time is going to be much more finite once you're a resident, especially in your first year. And I think that's a great thing because that's what you should be doing. You should be focused on being a trainee but that means other things are going to fall by the wayside. So if that is talking to your family, a certain family member at least, multiple times, a few times a week or every day, whatever that looks like for you, pick those things and hold on to them because I think those are very like grounding things, grounding experiences that just will serve you well throughout residency. So.
Great advice, Kyle. Anybody else want to add to that?
Now that you mentioned it, the fact that you talked about family stuff is actually really important. Just relationships in general. And this may sound really weird, trust me, but it will probably have made my life easier when I started residency. Is actually let people know that you're not going to be as available as you were before. Because I had some people think that I just hated them and, I just don't like responding to text or I just don't like hanging out anymore and all that. And again, cliche, everyone says residency is busy. We're all talking about it. People that did residency 20 years ago talk about it and you're like, come on, it can't be that bad. It's fun, but it's busy. Like part residency, as they said, it's very intellectually demanding. You go to work every day thinking you read something last night, you got it figured out. You leave at the end of the day feeling like you know nothing. You go back and study more, rinse and repeat every day for probably all of residency. And so, just letting people know that, oh, I may not be available so much anymore. And thinking about it, that I did that later on in residency and just setting those expectations made people understand things a little bit more because it can be annoying when you miss all the meetings and miss all the hangouts and family stuff, you're not there. And yeah, it seems like you're skipping on everyone. So
Yeah, and the question was about like personal goals too, right? So because I think a personal goal that I didn't really think about because definitely a people kind of pleaser person, but I think a good goal you should have for yourself is actually setting boundaries. Um, I think that we are in this mentality in med school where like you're evaluated at every corner, you're like and this rotation that maybe you care nothing about, you have to pretend like it's your favorite rotation in the world and give, give, give. But I think in residency, it's very easy to, especially in path residency, I think since we don't have like set hours for, okay, I'm seeing a patient this time, write my notes, go home. I mean, I'm again not trying to put clinicians in a bucket or anything like that. But I think in path residency itself, in general, it's very easy to just be absorbed in your work and then never go home because there's just always something to do. And there's always going to be an attending or a fellow or someone that requests this or someone that requests that. And I think it's really good to learn to set boundaries. Like first year, just let it hit you as a wave. Like just do what you have to do, like put your best foot forward. But then I think going into the next year, maybe try to set goals of like, okay, I'm not going to check my email on Saturday unless I'm on call or like unless I'm expecting something. Okay, like it's 5 p.m. I'm still at the hospital and I still have to finish previewing these cases. I'm not going to check my emails or phone or anything like that. Just like setting or like saying like, okay, like I'm just gonna, if I can't finish this amount of work at this time, I'm just gonna show up the next day and like say like, hey, like I was getting close to 3 hours. I'm not gonna keep going. Like I think just being able to set like learn to stand up for yourself and set boundaries should be a big goal that everyone should just make for themselves because I mean, I don't think it's going to get any easier in life when you're an attending. Like there's always going to be stuff to do and just being able to just be an advocate for yourself, I think is important.
I was in you sharing that, I was just thinking of another perhaps goal, maybe a more short-sighted kind of goal is just maybe in your first few months, give yourself grace and focus on being like an effective resident, not so much a diagnostician, because so much of what we learn early on is just like how to even be a path resident. It's like, how do I preview? Where do I organize things? Where do I find this? So just, I think that's a good maybe professional goal early on. Just like become an efficient resident because then you have the space to absorb all the diagnostic stuff. So I think that part is as eager as I think you come in as a path resident, you like want to get to all the diagnostics. You just can't quite get there just yet because you need to have, I would say, like a good framework foundation on what a resident looks like, a path resident looks like, in order to be really good at the diagnostic part or start to really take in the diagnostic part.
Oh, that's a really helpful tip, everyone. So on a different kind of note, and this question is directed to Dr. Akin Sanya. So what are some of the common pitfalls or mistakes that incoming residents encounter or should be aware of, and how can one avoid them?
I saw this question earlier. This is a fun one. We've talked about a lot of them already. We've talked about taking step quickly. We've talked about not trying to be a diagnostician early on. The other thing, like I suffered this a little bit, was most of the things I'm going to talk about, I suffered them a little bit. So I suffered this a little bit was I was very hard on myself when I started residency. I came in every day, I got something wrong, and I felt so bad. And then I spoke to one of my mentors much later on and he told me that you don't become a good pathologist until your second year in practice, which is like 8 years away from when you start residency. And so give yourself grace. I'm gonna say this and you're gonna hear this from so many people and you're not gonna listen and you're gonna feel bad. And then in your third year, you're gonna be like, I should have been nicer to myself back then. Just give yourself grace. It makes life easier for you. The other thing I like to advise people is and this has been alluded to already, is focus on being a good resident and not necessarily the best diagnostician. And what I mean by that is sometimes on rotations that you don't really like, we know we have rotations, we have subspecialties we don't really like. And I'm not asking you to take on all the tasks in that rotation to show them you're the greatest resident. No, but show up, be enthusiastic, do what you're meant to do, you know. Don't be that person that the person maybe is interested in derm and on all the derm rotations they are like going at it every time, they answer all the questions, they do all the assignments, they want to be at the two more boards, and then on the chemistry rotation they come in 30 minutes later than usual or they miss something. People see things like that and I've seen people burned by that quite a lot. So do not, in as much as you can't be 100% all the time, let your lower limit be like 90%. Don't be 100% somewhere and 50% somewhere else, because what you're telling people is that, oh, this is how good I can be, but this is how I'm going to be for you because I don't necessarily like what you do. And so just, it's a weird trap to fall into because you don't like what you don't like. It's not easy. So just be careful of that pitfall and always try to put your best foot forward. When you get back home at the end of the day, taking a deep breath and say, oh my God, that today was a rough day, but still just try to put your best foot forward as much as possible. I think that's a major pitfall. And yeah, pretty much everything else everyone has said. Saying yes a lot is also it's also another pitfall. But in this regard, I don't know how to get around it. Maybe the other panelists have advice on this because you have to say yes at the beginning. What happens is if you start saying no too early, people tell themselves like the attendants talk among themselves and they're human. It's not like they're gossiping or something, but they're like, oh, I have a project I want to do. They're like, can I give this person? They're like, no, I gave this person a project and he did it better. And you then realize, and you laugh, all of you have seen this probably in your programs, is that some people get a lot of work and some people get very little, which is nice when you want to chill. But if you want to get ahead and move, You want to be that person that people can come to. You have to earn the right to be able to say no later on. And so you draw boundaries, but don't let them be too, don't let the walls be too high. Don't say no to absolutely everything. Say yes to some stuff. And then when you've proven your worth and you've gotten those research projects and you've gotten into those committees and you've gotten the clout, then you get you've earned the right to say no later on. Now I can say no to a lot of things and everyone knows the value I bring to the table already, as opposed to maybe my third month in the residency. So yeah, number one, show yourself up everywhere you go. Number two is say more yeses than nos. And then all the other stuff was said. Step three, don't be too hard on yourself, etc. So
Thanks for the great advice. As a follow-up question to that, you mentioned something about research opportunities. And I just have a question in terms of how important is it to do research projects during residency? And also how early should we start these research opportunities? And also how much time do you spend on them during residency? And anybody can answer this.
maybe I'll just comment real quick. At this time, matters. And there are multiple opinions about this, as you'll find out when you start residency, but it still matters. You still have to do some at least. My program, there's a requirement to at least have one manuscript by the end of your 4 years, which is reasonable. Some people have that in 1 year already. Some people have 10 manuscripts in 1 year. And so in terms of how much you do, some people have research background when they're coming into residency, so they're able to hit the ground running and get started. Some people already have research background within the institution that they matched. And so for them, it's a lot easier. They can get started right away. For most people, I would advise you, especially early on, to learn how to be a part resident first. We are saying the same thing all the time. All of us are saying the same thing, but it's because it's true. So learn to be a part resident first, and then as you start to learn what you like, you can extend the hand out and learn how to or start taking projects up in those particular fields. In terms of how much, the sky is the limit. It depends on what's important to you. For some people, that's what they do. That's what gives them satisfaction, and they make good careers out of it, and that's great. And for others, not so much. So for everyone, our advice, take it slow at the beginning and ramp it up as you go along, depending on your interest. And for those that already have, very strong backgrounds, PhDs, done tons of research, then you just realize that in their third month, they already have posters and stuff out. That's fine too. Don't pressure yourself. Everyone's different.
I think research, especially in your first year, is really tough. As someone who just did it, if I didn't have my mentor, who was like, obviously she's the senior author on it, but she helped me so much in writing it, which has just not been my experience. Typically, if you're a first author, you're carrying a lot of the work. But I mean, she did a tremendous amount of writing and helping me, keeping me on track. Because there were times I would just get buried in my everyday work and it would just really fall by the wayside. So I think it's very hard to do as a first year. I would say if you're ambitious about it and you really want to do it, the most important thing that you can do is that I think you just have to like over communicate. Like you need to just be very clear what schedule you're on, what your hours are going to be, how much can you give to it. Because then I think it's a better understanding of how you fit into like the overall project that they're looking for, like whether or not that means you're going to be a first author or maybe you're just more in the middle, that way it's a better understanding going in. So I think this is an area where you just have to over communicate where you're at, how much bandwidth you have. It is hard because you want to say yes to things because you want to be engage and you want those opportunities, you want to say no to all of them, but also you don't want to overburden yourself in the sense that like now you've committed to something that you actually can't deliver on, right? Because you've burnt, that's almost worse than just saying no from the beginning. So yeah, it's a fine balance. I think you have to know kind of the scope of the project and how much it's going to take. I think a good research mentor will understand that though. They will say, well, you are a first year, you are like, if this is your AP, like if you're AP only and you're mostly on surge path, they're going to understand that you're going to be in the trenches a lot. So I would say a good mentor recognizes that, but if they don't, just communicate as much as possible. Over communicate rather.
Yeah, I really want to echo on that point. I think having a key, like a good research mentor is such a key. Like, and also not to beat yourself up if for not like having like a paper out like in the first year or anything like that. Like, there are like I feel like at my program, it's definitely evenly split between people that are academic and MD, PhD versus people more like me that are more geared towards like community, private practice, or and then even a little bit of people that want to go into industry. And like for people like me, like most of my research experience comes from undergrad, and I'm not like very proficient at it. So I needed to have a great mentor. And what I really appreciate about my mentor is that he actually went to trained at the residency program I'm at too. So I feel like he understood how busy I'd be as a first year and everything. So like he really did help like keep me on track and like keep things organized and like would find help find the resources we need for a lot of the things because like I have no experience. I'm just trying to be a first year. And I just think having those mentors are important. And then I have another mentor now who also has like been has been here for a long time and it's just like I feel like I'm not really justified in being a part of any of these projects, but through them, I'm learning how to do it. And the question of whether research is important or not, I think if you want to be an academic, maybe I think it probably is going to be important. I think that's how you get your clout. Again, I don't know, I'm community private practice, but I think for someone like me, it still is important to do a little bit of it. Like try to be a part of like something that's kind of like where you can watch the progression of it because in pathology, there's so many crazy things that are coming out all the time, it's still going to be important for you to be able to keep up to date and read the literature. Not everything is going to be an expert path or pathology outlines or Malavi or Kurt's notes. Like you have to be able to read papers. A lot of the cases we sign out are things that like you like aren't conventional and I know. So I think it's important to do it, but don't feel stressed out trying to find a project or get a paper out in the first year. Just the key, like people have been saying, just find a great mentor, take your time. And then you will find time later during pathology residency to really be a part of something and really push something out. So, but don't rush it.
Great.
Again, I meant my program director said, so just to tie up what everyone has said, really, I'm sorry for cutting you off. You're going to disappoint someone. You're going to say you're going to do something and you're not going to do it. And you won't be the first resident. You won't be the 1,000th resident to do that. So that's also fine. Just to, yeah, to round up.
Thanks for the helpful tips. So we are almost coming to our end. So I have a couple more questions left. And the next question is directed to Dr. Adeni. So support networks is something that's very important during residency. So during this transition phase and early on during residency, so what advice do you have in terms of building a support network, both within your residency program and also outside your residency program?
Yeah, I think that's a great question. Also, I forgot to mention this earlier, but you could totally just call me Ade. It's so weird, like disjointing hearing people say my last name because I like, is that my dad or my mom? Anyway, but like, yeah, Ade is fine. But in terms of connections and support, I think this is so underrated. It's so important. For me, like my family lives on the East Coast, and I'm all the way in the West Coast, 3 hour time difference. It's very tough. But I think just trying to keep a line of communication by calling them frequently is really important. Like even on the days you're tired, it's still nice to call them. But I think it's important to also try to make friends outside of your program. It's so easy. I mean, we've all been to med school. We understand like it's so easy to get caught in like your little academic bubble. But I think it's so important to step outside of it and just remind yourself that like thing like the life is still going like whether or not like you were able to finish previewing or like understood everything about this case like people are still just living their lives and having a good time and there's so much to do outside like I made a really big deal my first year to like do things like Coachella or like just go down to San Francisco and by myself and just put myself out there to like make friends outside of medicine because now it's like now you have the support of people that are in your program and outside your program. And I think it's really good to have that balance to just like help you see, I don't know, just help you gain perspective on things. So when things are rough at work, it doesn't feel like your whole life is tumbling down. It just feels like a portion of your life is kind of rough right now. But I don't know, it's just, I think that's really important. So I guess big things for me are like still call your family even when you're tired. Make friends outside of work and go outside by yourself. Go alone to things. Go alone to a concert. Go alone to like, I know it's like crazy. Like I went to a concert by myself one time and I was able to make friends with people. I went to a concert with a coworker one time and we met someone that's a Dungeons and Dragons master, and now we play Dungeons and Dragons every Monday. Even when I'm tired, I think it's important. Just like it's a very stream of consciousness right now. What I'm saying is like put yourself out there. I know we're pathologists, but be brave and go alone to things and make friends and just invest in yourself in that way too. I think it's so important.
When you have friends outside of pathology or in medicine, you get the I don't want to say painful, but kind of painful opportunity to practice explaining what you do in medicine. What do you do? What? So you're like in the lab? There's cells? Okay. Hmm. Hmm.
So funny. It's so funny. Like people are like, oh, so you're like talking to like dead people and stuff. I actually hate autopsy. Oh, sorry. I don't hate it. Sorry. No one heard me say that. I don't hate autopsy. I just don't like confronting death. I think it's like I'm a horror junkie, but like it's what I'm trying to say is I think it's just so funny to hear what people think we do and try and explain it. It's true, you get to practice that. But it's also just nice to like hear about other people's lives and like how different their life is and not being able to understand it and just like I don't know, and just talking about other things and realizing how big the world is and how small we are. And I don't know.
Great advice, guys. And this is a question that's more of a logistic question. Before starting residency, this is directed to Kyle. So what advice do you have in terms of managing personal finances during this transition period? And also, how did you approach relocating to your program city and any challenges that you faced uh, when you're relocating to a different city?
Oh gosh. Yeah, so I think the transition, so I was a career changer. So I worked before medicine and then I obviously went into medicine. Now I'm in residency. So now I feel like I'm back in the work life. But I can't underscore enough how important it is to at least have some kind of budget or understanding of income, like money coming in and money going out. I think I guess it depends also on your financial situation, but if you're one of the people who are some of the people who are more I guess responsible for your own finances, I would say you just really have to have a decent understanding of cash flow, like money coming in and money going out. Understand what your bills are. Start simple, like just break it down in terms of like an Excel sheet, right? Like it doesn't need to be anything fancy, but just start simple to have at least some understanding of it. I know some people come in with finance experience already, and then other people, this is the first time they've ever had to do that. But you're going to be responsible for your rent and insurance and understanding car payments and all those things. So just have at least a basic understanding of that. I think in terms of relocating, I would say that I have to assume the best resource for those kind of things are people who are current residents within those programs or the PDs or the APDs of those programs. Ask them, where are folks living? What's affordable? What's nicer? What's on the cheaper side? So it may not be as nice. I don't know. Get a feeling for that because you want to live in a place that you feel comfortable when you're outside of work. But you also don't want to live in a place where you're putting out unnecessarily like higher amounts of money than you need to. I think it's always, I feel like I was raised this way. So like I'm team like live cheaper if you can, especially for now, because there is eventually an attending salary coming to help you kind of offset some of your expenses. But for right now, residency salary, depending on where you're at, isn't going very far. So live cheap. That would be my best advice. Live cheap if you can.
I kind of want to say something really controversial too to add to that point. I don't know if this is really advice I should be giving people, but I'd say um, like it's like it's really important to budget, and that's really important to save for sure. But don't, I guess, like, don't get too hung up on like not being able to ever spend money on yourself. Like if you need to take a day to like relax or enjoy and you wanted to like, I don't know, go see a movie or something, like don't feel like, oh, I only have this salary, like I can't do this. I need to have my savings. Like if you're at the point where you're having a savings account, I'd say like maybe hold off, like in terms of dumping all of your money into your Roth and everything. Again, controversial statement. Like don't feel like you need to like match your Roth and everything like that right now. Like I was like looking, I was like, I don't know, I've been reading these books and like the amount of money you'll be making as an attending is just going to surmount so fast the amount of money you make all your years of residency combined. So like I think right now, if your wellness is like kind of taking a dump, like going down the dump, like invest in your mind now and keep yourself sane. And then because you will have all the money you need later to save. And the loans and everything are rough. Like we've paid so much money our whole life, but it is worth it to also invest a little bit in yourself. And again, controversial statement, but I think it's still something people need to hear.
I don't think it's controversial. I think it's real. Like, I think you have to like also live too. Like, you need those experiences. They keep us like human and enjoying life. So I agree.
Completely agree with what both of them said. It's while you shouldn't, go out and get not don't overspend and don't underspend. Again, resident salaries, think of it, I think of it as a stipend. It's designed to keep you alive and a little bit more on top of that. And so uh, don't go all out because it can vanish really quickly and then you get into trouble. But at the same time, yeah, live to some extent. And to like all the Roth IRAs and all of that fun stuff, get some knowledge about it is great. If you're putting something into that, rather than it being a means to build wealth, you're probably doing it just to get into the habit of doing that, just to give yourself the mental feel good factor that, oh, this is something I can do, this is something that's feasible. You're trying to teach yourself that, really. Not the money is not gonna, you're not gonna build a house based off on money you saved during residency. So yeah, I think everybody kind of aligns and ends up in the same place. It's, yeah, know what you're doing with your money and still live a little, but then don't overspend, as with anything. So yeah.
All right. Sort of we're a little bit over time, but thanks so much for the great advice and found it very helpful. And I'm sure everybody else on the audience found it helpful as well. So I'm gonna now turn it over to Nisa.
Yeah, thank you all so much. On behalf of PathSig, we want to thank everyone for attending this event and our amazing resident panelists for all of their insight and wisdom. We wish you all the best during the rest of your training and the best to all of our incoming PGY1s. As a reminder, this event was recorded and it will be posted online within the next day or so. And now we'll transition to part one of our step one review with Dr. Cameron Mirza for the rest of our spring symposium series. So if you're joining us, we'll see you in a bit. And if not, we'll see you next time. Thank you everyone so much for coming. Have a great day.